And this is how I know that insurance will completely destroy quality hearing care. Hey guys, welcome back to the DrCliffAuD vlog. This is vlog number 169, and if you can't tell by the intro of this video, I'm going to be talking about insurance and how it's totally destroying quality hearing care all over the place. But before I get into it, do me a huge favor, click that like button if you like these videos, and if you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well. It is greatly appreciated. With that out of the way, I had an interaction with a Hearing Up Network member about a month ago. And she's a member that I greatly respect. She provides really high quality care to all of her patients, and she is still in network with certain insurance companies, and she still accepts some third-party managed care programs. And she reached out because she was like, you know, Cliff, I don't know if I can stay in the Hearing Up network unless I can allow patients to opt out of getting best practice care. And the patients that she was specifically talking about were these patients coming in with these insurance programs. And the problem is that the reimbursement that the insurance gives the provider is so low that if that provider is going to be following best practices, they could actually be losing money by treating those patients. And so it really comes down to do they want to remove themselves from participating in these insurance and managed care, group networks and all of that, or do they lower the quality of care inside of the clinic? And this provider knows that I can't really lower the quality of care, because if I lower the quality of care, I'm not going to be eligible to be in the Hearing Up network anymore, because one of the criteria is that you have to provide best practice audiologic care. And so the simple fact that I'm even having this discussion shows you really where things are heading. We've seen a significant increase in the amount of people who call our clinic and they just ask, do you accept my insurance? Because that is the number one most important thing to them, is just that they get their hearing aids covered by their insurance. The problem is that most people don't realize that insurance, more often than not, does not reimburse a provider enough to make that provider be willing and able to follow best practice audiologic care. And so when someone's calling in thinking that, hey, if you take my insurance, I'm going to be able to use that insurance. Of course, I've paid money into that insurance, the premiums and all that, so I want to use that benefit. And they just assume that they're going to get the same level of care no matter where they go. Now, here's the thing. At least up until now, there have been some clinics and Hearing Up members who have been able to give a really high quality experience and high quality of best practice care to individuals who are using their insurance and who are using managed care programs and all of that. But what we're starting to see now, especially since the pandemic and especially since all of the inflation that's been going on, it costs a lot more to run a clinic. And so it's kind of putting a lot of these providers who are accepting insurance into a weird position, because insurance reimbursement rates are actually going down. And I know that seems ridiculous because inflation's going up, reimbursement's going down, the cost of doing business is not going down. And so it's a question of, do we decide to get out of insurance completely so we can charge whatever the market rate is for these best practice services? Or do we stay in these insurance groups and either take a loss on performing certain procedures that are considered best practices, or we just don't perform best practices? So you see where this is going, right? I just think with the proliferation of these Medicare Advantage plans that contract with these third-party hearing aid benefit programs that are designed to, positively give people lower cost of care, but it's also giving them lower quality of care. And, here in the next 5 to 10 years, I think that there's going to be a significant separation of clinics. I think that there's going to be certain clinics that are providing exceptionally high quality care. There's not going to be many of them, but there's going to be some clinics that provide that exceptionally high quality, but they're not going to be accepting insurance benefits. The other side is the very low-end clinics that have no way of really differentiating the quality of what they do, because they're just churning and burning patients who are coming in using their insurance benefits and their third-party benefits, and they're not getting reimbursed a whole lot. So what's the only way to compensate for that? Well, you get more people through the door and get them out quicker and providing them with lower quality of care. Like, that's the only directions that we can go. There's no more middle ground. Like, that middle ground is starting to go away, and you're either going to be functioning up here as a clinic or down here as a clinic. And that's sad, because I think that with the pressures from a consumer standpoint and from an insurance standpoint, but there's something psychological that happens when you have an insurance benefit. And I have insurance myself, and I'm keenly aware to this, is that I pay these really high premiums every single month for my health insurance. And so when you give me the option of going to a provider who I need to go to, who's in network, versus one who's out of network with my insurance, like, you naturally have this desire to be like, well, I've paid all this money already. I want to use that benefit with an in-network provider, so I spend less money on actually paying that provider. But what I found personally is that all of these providers that accept my in-network benefits, they don't care about the quality that they give. At least I haven't found any that have cared about the quality. So you know what I do? I actually pay out of pocket. Now, I know that I'm fortunate and maybe even privileged to be able to do this, but I pay out of pocket to go to a provider who's going to do things the right way and treat me the best way they possibly can, because they're not being dictated by the insurance company. And it's happening everywhere. It's not just hearing care. It's happening all over the medical landscape, where really insurance companies are dictating everything. They're getting massively high record profits, but they're actually reducing the reimbursement to providers, so it forces the providers to see more people in less time. And it's not going to get better. It's just going to continue to get worse. So you really have to ask yourself, are you the type of person who just wants to get use your benefits and get hearing aids at a low cost and getting getting audiologic care at a low cost? Or are you someone who actually wants things done the right way? Sometimes you can use an out-of-network benefit. It might not be as good as your in-network coverage, but you can at least use that with a provider who is following best practices. So, to kind of like wrap this all back up together from the beginning, is that I had to basically share with this provider that, like, listen, if you do not follow comprehensive best practices with all of your patients, unfortunately, we'll have to remove you from the network. And that kills me to know, because I know that for the majority of her private pay patients and even her insurance patients, where the insurance will actually cover the cost of these services, that she does a very good job for them. But we can't sacrifice quality in order to fit the mold of what insurance allows us to do. That is not in the best interest of our patients. And you could argue that. You could argue that what's in the best interest of the patients is what's cheapest for the patient, and whatever. You can make that argument. And I probably wouldn't want to have that argument with you, because I have my own perspectives of what's the most important when it comes to hearing, and that's actually hearing your absolute best. But it's sad that this is probably not the first time that I'll have this conversation with a Hearing Up Network member, which means that over the course of time, it's potential that the Hearing Up Network completely erodes away to nothing because of insurance pressures. And that's sad to think about, especially when I know that at some point in my future, I will likely need hearing treatment. And there's a good chance that it'll be extremely difficult to impossible for me to identify where to go that'll provide me a high quality of care. And on top of that, the insurance premiums that we pay will be even more than what we're paying right now, but there's no guarantee that if I use my in-network benefit, that the person that I go to will even give a crap about providing high quality care. They'll probably just be like, okay, well, you're in network. Yes, you get a lower cost on your treatment, or they cover this amount, but we got to get you in and get you out, because we just don't make enough money to keep our business going with having coverage from insurance. So it's kind of sad. I've made the decision inside of my clinic that we do not accept any in-network benefits. We are not in network with any insurance companies, and we do not accept any third-party manager programs, right? And it's because they just don't reimburse at the rate that we would need to provide the highest quality of care possible. And I sympathize with other clinic owners, because I have the benefit of having my YouTube channel where people are like, hey, listen, I'm struggling with my hearing. I just need to go someplace that gets it done right. I don't care about insurance benefit and whatnot. We get to benefit from that. And not every single clinic out there has that kind of reach to communicate with those people who just want high quality. They have to rely to some degree on insurance companies referring them patients, and that just kind of sucks. So, you know, in our clinic, we're a little bit more shielded from it. We do help patients utilize their out-of-network benefits, which can sometimes be really good. It just depends. But it's really the third parties that are destroying it, because a lot of these insurance companies, they're like, they contract with these third parties, and the third party's like, no, you can only go to someone who's contracted with us as a third party, which means that you can't use your benefit in my clinic if you have a third party manager controlling your hearing care. It's really just unfortunate where everything has gone inside of the hearing industry. Again, you know, 5 years from now, it'll be very interesting to see how much erosion there is in quality of care, and I guess I'll have to do another vlog about it at that time. So that is all that I really wanted to talk about today, guys. Sorry to be a little bit of gloom and doom here, but the landscape out there from a hearing care and insurance perspective is not good. So I would urge you to consider looking at what your insurance coverage is, and then if you're not happy with your overall hearing care, you might have to forego it. But that is all that I wanted to talk about today, guys. I greatly appreciate you hanging out with me for this particular vlog, and as always, I'll see you next week.